I'm Stefanie Aber. I'm 48 years old. I live in Wall, New Jersey, and I was first diagnosed with breast cancer on July 22nd in 2013. I'm a 3-year survivor. So in 2011, I had had a questionable mammogram, and I'd had a biopsy along with a surgical biopsy for calcifications. And so they decided to monitor me on a 6-month basis. When I went back in 2013 in February, they found a microscopic dot in my left breast, which they felt was questionable, and they couldn't biopsy it at the time. We tried the stereotactic and they couldn't get it, so then I came back in 4 months, and it was at that point it had grown in size, and even that day of my mammogram, Dr. Wong performed a biopsy on the spot and told me that she was pretty positive to expect this was going to come back as breast cancer, so I kind of knew right away. I was on a cruise ship in the Atlantic Ocean. I actually received a call on the cruise ship from Dr. Kamal, who had followed my case, and when I spoke to her, I immediately felt so much better, and she explained to me the type of cancer I had, and that she would be able to remove the cancer, but that I would need extensive treatments after, since it was HER2 positive breast cancer and not estrogen sensitive. My primary care physician is Dr. Pass, and many times he came through for me on different things, etc. I had Dr. Kamal as my breast surgeon, and I couldn't say more wonderful, phenomenal things. She is just amazing. And Dr. Griffith is my plastic surgeon, and people are just like, how did you know what to do? And I said I let her pick and choose because she knew exactly what she was doing. She was great. Dr. Susan Greenberg is the funniest person I know, and every day I saw her, she made me laugh, and I always said, you know, if I keep laughing, I can't cry. I'm so happy they found my cancer early, and I'm going to live to be 80 and eventually be a resident at a Meridian nursing and rehab facility where some of the younger folks will take care of me like I take care of the people today, so I'm really proud. When Dr. Griffith told me there was no evidence of disease after my surgery, I knew I had it beat at that moment. I was tickled pink. Michelle and Kathy and I have been friends since I joined Meridian 18 years ago, and we work together as a part of Meridian's continuum of care. They're Meridian at home, and I'm working Meridian nursing and rehabs, and they came to the hospital that night. It was just like hanging out with friends, and I wasn't really in the hospital, and it was really important to me, and so I appreciate them and will forever be thankful that a bad day turned into a pretty great day. So life is great now. You know that it will be behind you at some point, and once it is, every day is a little brighter because I put my shoes on and now I can walk out the door and I can live my life and be well, and you really do appreciate it when you're through it. You know, you're just stronger, better, happier. It's good. I really do believe Meridian Health saved my life in finding my cancer early.